Blood pressure. What every nurse needs to know. Blood pressure. The one number that can make or break your shift. Too high. Crisis mode. Too low. Also crisis mode. Let's break it down fast. Blood pressure is the force of blood against artery walls. Since blood moves in waves, we measure two numbers. Systolic top number, pressure when ventricles contract. Think of it as the height of the blood wave. Diastolic bottom number, pressure when ventricles rest. This is the constant pressure in the arteries. The difference between them, that's pulse pressure. Normal is about 40 millimeters of mercury, but during exercise, it can skyrocket to 100 millimeters of mercury. What's normal versus when to worry? Normal BP, 120/80ths of a millimeter of mercury. Hypertension, above 140/90ths of a millimeter of mercury, or 130/80ths of a millimeter of mercury for diabetics. Hypotension, below 90/60ths of a millimeter of mercury. Watch for dizziness, syncope, and shock. NCLEX tip. A sudden BP drop, like 180/100ths right pointing arrow 120/80ths post-op, signal bleeding or shock. Call the provider ASAP. Heart pumping action. Weak heart equals low BP. Strong heart equals high BP. Peripheral vascular resistance. Vasoconstriction e.g. Smoking equals up pointing arrow BP. Vasodilation equals down pointing arrow BP. Blood volume. Low volume dehydration. Hemorrhage equals down pointing arrow BP. High volume IV overload equals up pointing arrow BP. Blood viscosity. Thick blood high hematocrit equals up pointing arrow BP. Other key factors. Age. Newborns have low BP. Older adults have higher BP due to stiff arteries. Exercise and stress. Both spike BP temporarily. Race and gender. African Americans tend to have higher BP. Men have higher BP until women hit menopause. Obesity and meds. Extra weight equals higher BP. Meds like caffeine or antihypertensives can raise or lower BP. Time of day. BP is lowest in the morning, highest in the evening. Temperature. Heat equals vasodilation, down pointing arrow BP. Cold equals vasoconstriction, up pointing arrow BP. BP equals heart plus vessels plus volume plus viscosity. Know your patient's baseline. If BP suddenly drops or spikes, act fast. It could save a life. Follow. Prep the nurse. For more quick nursing breakdowns that stick like EKG leads on a sweaty chest.